Hi, Mr. and Mrs. Smith. My name is Barbara Lucas, and I'm a student from Oakland Community College. And today, I'm going to be doing a newborn assessment on baby Smith. So I'm going to wash my hands before we get started and don a pair of gloves. I'm going to verify baby Smith's identity bracelet. I'm verifying the numbers matching the parents' numbers. I'm going to make sure that baby is kept away from any cool drafts and preferably underneath a warmer, which we could pretend that the light above is a warmer. I have baby in crib here. He is wrapped with a single layer and one blanket and a hat. So I'm also going to make sure that my hands are warm, they were washed in warm water, and when I use my stethoscope that it is also warmed to keep baby warm. To start, before I disturb baby, I'm going to listen to an apical heart rate for a full minute after I warm my stethoscope up. Not to disturb him too much, I'm going to slip it in and listen to the apical heart rate for a full minute. That heart rate should be 110 to 160, and the respirations should be 30 to 60. The infant's breathing pattern is irregular, and there could be pauses. Baby's heart rate is rather fast as well. So to take baby's temperature, we'll get our thermometer, and the thermometer should be placed parallel to the baby's armpit so we don't accidentally take the temperature of the mattress or bedding behind baby. So as I pick baby up, I'm going to make sure and support his head and neck because they have poor control of the head, and I'll place him here and place him sideways. Temperature is going to be the last thing that I do because they typically like that the least. So as I was describing before, the thermometer should go parallel to the baby under the arm to get the accurate temperature reading. The temperature should be 36.5 degrees Celsius to 37.5 degrees Celsius. The baby should have generally a relaxed posture before I agitate him. Probably sleeping. They should have some muscle tone. They should not be too rigid. The skin coloration should be pink. They may or may not have slight bluish tint to the hands and feet still, which would be acrocyanosis. That is normal if for the first 24 hours of life. The head and posterior fontanelle can be felt if I cup my hands like this along the back of the head, and it should feel like a notch on the posterior side of the head. And the anterior fontanelle, which is diamond shaped, would be felt in the front along with the soft spot. There should be, you're feeling for overriding sutures, you're feeling for the soft spot, you're feeling for any flatness, and you're also feeling for any cephalohematoma or caput. And the difference between those two is caput would be fluid just under the scalp tissue, and it does cross suture lines. The cephalohematoma, however, though, is blood, and it goes in between the periosteum and the scalp, and it does not cross suture lines. The abdomen and bowel sounds we can listen to as well. So once again, warming the stethoscope, and you're also watching the respirations for any signs of labored breathing, such as retractions or unevenness, flaring of the nostrils. But you would want to listen to all four quadrants of the bowels, making sure you hear movement in all four quadrants. While I'm at the abdomen, we're also checking the umbilical cord to make sure that the stump is intact and drying. You want to make sure and keep it dry during the process, of which it'll fall off by folding over the front end of the diaper and keeping the diaper off of it. You also want to examine the genitals. For a little boy, the testes may be swollen, and for females, the labia majora might be swollen. There might be a little bit of discharge. There might be a little bit of red tinge discharge for women or girls, or the white discharge, and that is normal based on the baby kind of acclimating and still processing the hormones from the mother during pregnancy. Some of the reflexes that we're going to assess for are the grasp reflex, so the baby should grasp your fingers when you place them in their hands. The moro or startle reflex, if you gently lift the baby up and gently put them down, they should have a startle reflex where their arms get held up. The next one is the Babinski reflex. So we would take baby's feet, and I'm showing you the bottom of the foot. If you were to gently stroke the bottom of the foot, the baby's toes should flare out on both sides. And then the next one, supporting the head again when I lift baby up, they should have a natural stepping reflex. So they kind of want to put one foot down and lift the other one up. The other things that we're going to assess for, we want to make sure that baby's eyes are in line with their ears and that the ears are not set too low. We also want to make sure that with a gloved finger, the baby's sucking reflex, checking the palate, is intact, and that the baby has a strong suck reflex for feeding, whether it be breast or bottle fed. Next, we're going to talk about safe sleep guidelines. So safe sleep for baby. So we always want to put baby alone in the crib, on their back, not co-sleeping, not with stuffed animals, no fuzzy blankets. We always want baby placed on their back so that there's nothing in the crib that they could possibly smother themselves on or get tangled up with, because at this age they don't have the neurological development to or the neck control to lift their head away from anything if there should be anything around their face and mouth. During the first 24 hours and 4 days of life, baby should have 1 poop on the first day, 1 pee on the first day, 2 pees, 2 poops on the second day, 3 on the third day, and 4 on the fourth day. The first poop is a very tarry substance called meconium, and that kind of signifies the movement of the bowels is initiated and starting. The expected weight for a newborn baby may lose up to 7 to 10% of their body weight. We don't want them to lose more than about 7%. And within the first couple weeks, we would like them to regain that, and the pediatrician will be checking that after discharge on your first follow-up. Signs and symptoms to report once you take baby home with you. Any temperature higher than 100.4 or any temperature lower than 97.9. Any changes in feeding pattern, poor feeding, baby's not eating, baby is vomiting excessively or violently, excessive diarrhea, labored breathing, the signs that we talked about before, any of the flared nostrils, or you hear kind of like a grunting or a sighing sound while they're trying to breathe, any blue around the mouth, you see any retractions in the ribs while baby is breathing, or if the baby starts to have any kind of yellow tint to their skin, that's something to report to the doctor, and the baby might be having signs of late jaundice. So the next thing that we want to talk about is safely placing baby skin to skin with mom, because it is one of the best places for him on releasing feel-good hormones and eliciting a good feeding pattern and regulating temperature. So we're going to strip baby down to just a diaper, and we're going to, again, supporting the head as you pick baby up. We're going to have mom remove clothing also, and we're going to gently nestle baby in to mom's clothes. And you always want to make sure, so let's tuck baby in here. We always want to make sure that his nose is visible and that we're not blocking his airway completely. So it's okay to snuggle baby in nice and tight, putting a blanket over the top, but always making sure that his nose is visible. So the next thing that we want to do is we're going to swaddle baby. So I don't have a blanket here, but we would swaddle baby, folding one of the corners of the blankets down, placing baby here. We're going to keep the arms in close to the body. And we're going to wrap the top up. And because baby here seems to be regulating his temperature well, we're going to leave him in one layer, no hat. And we're going to safely place baby back in his crib now that his assessment is finished. Yeah, I think that completes our assessment.